Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and wanted to talk this afternoon about what you can do with the human face. I mean, it's amazing what you can do if you put certain pressures on the facial structure. You can change things. And this is I read on this case that we did back in I think it was 71. That was just a little while after I quit doing regular orthodontic, regular dentistry, and started into nothing but orthodontics. But I had done orthodontics for several good many years before this, and had this young man who I had straightened the teeth on several young ladies that went to church where he did, and they just insisted on bringing him down, and they twisted his arm and got him to straighten his teeth, everything. And so let me show you what happened to this young man in less than 2 years. It changed this young man's life. So let me show you. We were talking about J-hook headgears, and we were into J-hook headgears at that particular time. And so we did this case using 2 J-hook headgears. I've never seen anybody doing 2 of them at once, but we did, and this young man put up with it. And let's show you what the results we got. And we extracted some teeth on him also. So let's get going here. I don't show much on the method in here, but we'll just show you. Here is the young man, and we've got these 2 J-hook headgears on him. Let me get my little line going here, and I'll draw as we go along. And these are 2 J-hook headgears, and one of them is just a occipital type. We'll show that on the side looking at it. And this is not 91, this is 71. This is 11 of 71, I believe that's the date on this. And let's look at it from the side. And I never dreamed we could get somebody to wear this, but he is coming in with these young ladies were really pushing him to get his teeth straightened. And so we used an occipital headgear and went down and hooked on the upper teeth and picked them up and brought them back. And then we had a cervical type J-hook that we wear right straight across. And this is kind of a high pull situation, but it's kind of pulling it back in this. You have to divide the area between here and here where it's pulling the teeth back. And we're taking the facial structure back at this time, and we're also reducing the vertical height of the lower third of the face. And I've just got a few pictures here on this, and I'm going to go back. Now here we are hooked up. We hooked the J-hooks in here. This is the cervical one, and here is the occipital one that's coming up from there, and we're picking these teeth up. Now the guy had too many teeth. He was just too full in the face. And back in the 70s, we took out a lot of teeth, and I'm glad we took out teeth on this young man. And this is 4 of 1971. We were already hooked up, and back then we had nothing but bands to put on the teeth. So we end up having a little space around some of the teeth back here before we got through. When we took these off, now we show you what we did. We got the teeth as close as we could, but we gave them a little more torque than we actually wanted. And when you close those spaces, you reduce the amount of torque in there, and I'll show you how we close space. back in 71. Now this is just a few years, probably a lot of people out there were born when we did this case. And I'll show you what. And then we pull this back and we open the bite, level them all up, and you can see when we look at some of the other pictures here and finish the guy up. And now we took out the first bicuspids on both sides, upper and lower, and we're going to bring these teeth back, and we're going to reduce the vertical dimension of the face by wearing that occipital type headgear. And we reduce the vertical height, and we bring the profile of the case back. We brought these teeth back quite a bit in here, and we would bring these forward some. They'd had a lot of dental work done, and he lost one of his teeth in the time that we were checking him over a period of about 23 years. We got him in and we took pictures of him. And so let's go on from here now. We're picking that up. You can see how these J-hooks hooked right in between the teeth, right in here. And now on the bottom, we hooked right in between here, and we're pulling these teeth back, and we're also reducing the vertical height of the face of the person. So this is 4 of 1971. We were doing this. And 71 years ago, that'd be 30 and 23, so that's about, that ends up to be about 50 years. So we'll show you. I haven't seen the guy for years, but I would love to see him today if he's still going. Now, when we got where we were as good as we could, and we had them torqued a little extra, we took everything off except the molar bands back here. And we took a long, light elastic. We put a daub of acrylic on the cuspid teeth. You can see right here. And then took an Explorer and made a groove in it. And we hooked this rubber band and we ran it in that groove all the way to the other side. And took another rubber band and put it in here. And we had the person chew bubble gum of all stuff. I mean, the teeth would get sore moving, closing all this space and reduce the height. And this is where we came up with something that you put on the teeth and move them. It'll do certain things, but it doesn't do everything. Now, so we closed the space up in about 3 or 4 days, and we got the guy back. We didn't want it, and once it got the gaps closed, boy, we took impressions of them, and we built retainers, and they wore the retainers. And then we kept the model, and we used a wraparound retainer. It comes up and comes around and comes up over here. And you've seen our retainer, how we do. We have no clasp going across. Now he wore them for a while, but I'm sure he kind of played out on this. But this is 3 of 93 now, and that was 4 something of 71, and it was about 471. So this is in a month less than a year, we had this case finished. In other words, as far as we could go with this. If we'd had brackets, we could have closed all the space and done a much neater job of it, but this turned out really good. Thing that you can do with a human face. Now there we're closing. We just hooked that on, and then we took the bands out, and we put a retainer, and we tried to close the little gap on the retainer to bring the teeth together from the back. And so it didn't work completely there. But here's less Then 2 years, we closed that space up and also reduced the vertical height of the face in here. And we took these off, then we took those bands off and made retainers that fit on there. And then he wore this retainer for a good while, apparently, and kept this together. But after he stopped wearing it some, we got some space back in here. But we followed this case for 23 years, as long as I could get him. And he came in, and we would see him, and we took pictures of him. And he lost one of his teeth. It had a bad cavity, these were pretty badly broken down, but one of the second molars is gone here. Now here it is in 1990. Let's go back here, and this is 73. Now in 1990, we had him looking like this. This is from 73 to 90. You've got 7 and 73 and 83, and then from 83 to 90, you've got a good many years there. Now we follow him to 1996, I believe. All right, here it is in 1990, and that's held up. This is teens, so many years there. He held up. And 90, that's from the side. It looks great. Looks great from there, except he has lost this tooth back here. And this kind of opened up a little bit right there, but nothing any really drastic thing. Here in 1990, the upper teeth did move out further, and it opened the gap. And if we'd have had brackets on him, we could have controlled that. But here it is. This is 8 of 73. That was when we finished the case up. And we're going to watch it all the way to 96. And here it is in 96. There it is in 73 on the right side, and there it is in 96. So you see the difference. And we closed down a little bit. And here's 8 of 73, and here is 3 of 96. 3 of 83, in other words, we started in 80, and I say 3 of 80 is 8 of 80, 73. We started it in 4 of 71, I believe. So it's 72 and 73. It took a little, slightly less than 2 years to get here. Now these young ladies that had encouraged him to come into the office, I had straightened some of their teeth, and he got to looking so good that he moved on to some better looking women, I think. And I didn't follow the case too close, but he moved on up in the ladies' world. Here it is in 96. Okay, 98, 73, and his face opened some. It's still there in 96. 88 of 73 on the bottom, and he loses a tooth on the bottom, and this is the lower left second molar, apparently. And I don't know what happened to his wisdom teeth, but anyway, we may have had them taken out, or maybe he just didn't have them. But this is 3/28 of 96. That's about 23 years after we finished. Now, here's what I want you to look at. You look at the profile of this young man. Now we needed to reduce this profile and bring it in, and we needed to lower this height of this face here. In other words, close this up to make the facial structure look better. Now here we are. And there is another view of it, 2 of 71. And we're talking about 73. We got him fixed up, everything. Now here he is in 1973. In other words, less than 2 years. This vertical height of the face is less. This profile is considerably less. Go back and look at this. Look at where his profile was. Look at how the guy looked. So you can do things to the face. So we were able to eliminate, maybe if we took the wisdom teeth, I don't know. But we close this up. Look at the facial structure here. This is a less, in other words, it looked really good. Now let's look at it a little later. This is only 2 years after we started. And now here is in 1990. The facial structure is reduced again. I mean, it's a normal vertical height of the lower third of the face. And here it is in 96. It still looks almost ideal. Here he is, and 2 of 71 when we first started, and we worked on it for about a couple of years, and you watch this reduction in this vertical height of the face, and also the reduction in the profile. Look at the vertical height now. And go back and look at it there. And the protrusion brought in. And people who say, you should never take out teeth. This is ridiculous. If a person gets a huge tooth from one side of the family and doesn't have room for that, and then they're protrusive out here, you can make the face look so much better. I mean, we changed the life of this young man. He at least quit going with the same girls that brought him in there. They messed up there. They lost him. Now, here he is in 73. It's just 2 years we've made that much change in that person's facial structure, and as far as that goes, in his whole life. You change the whole person there. There he is somewhere in 70, I think that's 90. And here he is in 96. There he is. There's 71 before we started, 73 after we finished, 96, 93, that's 90, and 96, there he is. And here is the man in 1990. I'm just encouraging people. I have loved doing orthodontics or working with people like that. And you can change the whole person, and it was such a, I enjoyed the work, and I worked till I was 88 years old, and then I got a little shaky, so I quit. But then I went back and I lectured, and I saved all these cases up that were of real interest, and have tried to share them with people. And now the video and the YouTube is spread. You can spread this all over the world, and so I wanted people to understand that we can do this same thing, or we could do it years later. We didn't use the J-hook headgear all that much, but we'll show some other uses of headgear. And thank you for watching, and I want you to join my channel and subscribe to it. And it's been a pleasure working with you. I hope that we can make orthodontics a much better thing. So much horror going on today here that you can't think about straightening the face out and doing things like that. So I hope that the good Lord takes care of this wars that are going on and the earthquakes. It's a sad world sometimes, but you can improve your face of people. So I hope that people that are doing orthodontics, whether you are an regular orthodontist or you're a general dentist, and just know that the temporomandibular joint is connected to the jaw, and there ain't no way you're going to do it without having some effect on the jaw. And you can take out teeth, and you should on some people, but in certain races you don't want to. So let me close up there, and thank you again for watching, and I'm going to close out and stop.